community mental health counseling. So I'm LPCC. I'm going to mute as many possible things in my background as I possibly can because there's too many noises. And funny story, I once got a heart-shaped pizza unexpectedly and for free on Valentine's Day just because I ordered pizza from a local place. It was odd, but funny that that was the question today. So looks like hopefully you're seeing the correct thing. Very good. While I'm going through this, I won't be able to see people's faces, but please feel free to jump in and interrupt me at some point if there's questions, comments. I know I'd like to make it a little bit interactive, but yes, the topic for today is to Google or not to Google, and really looking at the ethical considerations about whether or not we should be looking up patients online. Kind of general disclaimer, this is, information shared during these is, represents the opinion and expertise of myself and not those of Northeast Ohio Medical University, although I don't think that I'm saying anything super controversial. I leaned on the literature for this. Learning objectives, just to be able to find what patient-targeted Googling means, and as identifying collateral information. Goodness, I can't talk today. Explore the rationale and potential benefits and any ethical considerations and possible downsides to it. So we kind of know this already. It's a little bit of a busy slide, but I thought it was easiest just to be able to show some of the graphics. But we know that almost everybody is online. I don't know at what point they decided that YouTube counted as a social media platform. I suppose it might depend on how much you engage in the comments. But on the left, you could see the percentage of US adults who say that they ever use a social media platform. And on the right, it's the teens ages 13 to 17 and what platforms they are using. YouTube consistently is the one that most folks are on. Adults, Facebook comes in at number 2, where youth, that's more TikTok comes in at number 2. And you can see how things have kind of jockeyed for standing over the years. See a little bit more shifting of that amongst youth than adults. Kind of interesting data, but most folks are highly engaged in some fashion at this point. So patient-targeted Googling. I know that we can discuss and debate whether or not we should be using the term patient, client, consumer, person that you're working with. I use patient for all of this because when I put this together, originally it was for a crowd that had more doctors and psychiatric nurse practitioners involved. And so that's kind of their terminology of choice. And it's the term that I was able to find in the literature most often. So it is the act of searching the internet for information about your patients or their families, with or without their knowledge. And collateral information, so this is one type of collateral information. Collateral information is that information that we get about the folks that we're working with that comes from other sources, so other than the patient involved. So whether that's information from teachers, from other systems that you work with, from the family, any of that collateral information is potentially there, but we have to always be skeptical of collateral information. We don't know if it's true or not, and that is heightened when you consider the internet. Lots of people admit to engaging in patient-targeted Googling. In a variety of surveys that they did, over 50% of the mental health professionals surveyed in New Zealand. So it was almost 2,000 individuals working in the mental health field. So psychiatrists, psychologists, counselors, social workers, over half of them were saying that, yeah, they admit to patient-targeted Googling. And in a study that looked at a New York mental health system, almost all of the psychiatric faculty and psychiatric residents admitted to Googling their patients. And then it broke that down into why, so what reason did they cite for actually Googling a patient? And in the psychiatric emergency room, most of it was for patient care. So 63%, they're trying to figure out how to best serve this patient. When it was private practice or outpatient treatment, it was 40 to 43% was the top reason cited, and that was just out of curiosity. Patient request to have themselves Googled was noted to be the least common reason, regardless of site or setting. There are potential benefits to Googling your patient. You might be able to identify discrepancies and things that they're sharing with you, provide a more complete picture of the patient or family for a case conceptualization purpose. You might be able to get a better sense of hobbies, interests, lifestyle, Potentially enhance an understanding of their interactions with others. So you might be able to identify different support systems that maybe they don't bring up or see as a support system that could be, and identification of potential dangers. So are you seeing things that indicate suicidal thinking, self-harm, risky, risk-taking kinds of behaviors? There are times when patient-targeted Googling might be justified. Here's kind of a list that's from the literature. So if you see something that makes you feel like there might be a duty to warn, so risk, imminent risk to self or others. If for some reason you believe that they might be engaged in kind of doctor shopping, you might be able to see some of that through online information. Obviously, ORS is one place that doctors can get that from a controlled substance perspective, but you could also see it in the kinds of things that people post on social media. If patients or families are giving you evasive responses to kind of logical clinical questions, but they don't want to answer them. Claims that seem kind of improbable. So if you hear some really wild story, maybe trying to just verify, is this true? And sometimes you could get that not even from social media, but like news stories, especially if it's somebody that maybe recently moved to your area. So you want to figure out if the story that they're telling from whatever place they were originally or lived previously actually happened. Discrepancies between the clinical record and what they say verbally. When you have a sense of clinical urgency or you're trying to figure something out, then it does really require you digging into more information. So that might even be like, there's somebody that's in an urgent crisis. I can't get a hold of their typical contacts. Who else can I reach out to that's in the family? When you receive discrediting information from another reliable health professional. So you've heard a bunch of things from the family, but now you talk to the nurse at the school, one of the teachers, and things aren't really adding up. Incongruent information between the patient and maybe them and their family. Anytime that you suspect physical abuse, substance misuse, some type of risk of harm to oneself or to others. And not that you're going to be able to find things, but these might be reasons that it would be justified to Google your patient. So a couple case scenarios, and not necessarily geared towards the age groups that all of you necessarily work with, but I think we can easily translate this one. So doctor treats a patient for bipolar. Patient goes into the hospital for mania and psychosis. At the hospital, they're started on an antipsychotic, some mood stabilizers, and referred back for outpatient. Patient comes in and says, hey, how much I've improved since the hospitalization. I'm 1,000 times better already. I've realized that I'm on a sacred journey of recovery, and I've started to blog and record all the ups and downs. The blog is going to be huge. I already have a bunch of followers on Twitter. So doctor gets curious, like, should I look up the blog? It might help me to get to know him better. On the other hand, is this crossing a boundary? The patient didn't ask me to look at the blog. So is this a violation, or are they going to feel like I'm breaching some kind of trust? Possible risks of Googling your patients. You could break down the relationship. If they don't know that you're doing this, particularly if they don't know that you're going to do this, and you find out information, and then they find out that how you found that information out, that might not sit real well. So it could very much break down that relationship and that trust. The information that you see online might create a bias. So it might change your perception of the individual or their family. And clinical decisions, we know, are influenced by our own bias, even implicit bias. So our clinical decisions might end up being influenced by the information we see online if, even some implicit bias starts to seep in. The information online might be inaccurate, incomplete, or lack important context. We all understand this very well. You can't get you can't get the complete picture from, 140 characters on Twitter. And it could potentially constitute a boundary violation. So a second case scenario, and this shows a good breakdown of the relationship. Patients accruing a large bill, even after negotiating a reduced fee. Imagine this scenario was more in like a private practice. That's my assumption, but it was coming from the literature. Provider searches Google Maps and sees that the patient's address is a large mansion. And then they search the appraised property value. Now the provider's mad because they're like, why are you not paying me, even though you clearly should be able to? feeling like the patient's misrepresented their financial situation, confronts them, when in reality, the patient was renting a small basement room for a very small fee and the agreement to do yard work around the property. So patient's pretty offended, doesn't return. So ethical considerations when we are looking at whether or not to Google patients, to look online, to tap into collateral information, it is, are we going to engage the patient in informed consent? Do they know that we're going to do this? Did they give us permission to do this? Is it a conversation? Are you going to document what it is that you've done and what you found? Because let's say you do search for something and you see potential evidence for suicide ideation or some kind of self-harm, eating disorder. Now you have to do something with that because now you know the information, but you're going to have to document how you got there. And once you've documented it, now the patient and family have access to that. The disclosure of it. So how do you go about explaining? Apologize for that background noise. Have to go about explaining how you know the information that you know, and that could be a very uncomfortable conversation. The relevance. So thinking back to that reason cited by a group, a bunch of folks in outpatient and private practice, is curiosity a valid reason? And is what you're finding clinically relevant or relevant to the care of the patient or not? Is the behavior voyeuristic? Are we just being nibby? Because that doesn't seem like a very good reason to be doing things. And imminent risk. So there's kind of pros and cons and an ethical debate to be had around a lot of this, but it becomes a murky area. So in a 2010 article, they proposed that before engaging in a search, you reflect on the following 6 questions. Why do I want to do the search? What is it that I think that I'm going to find out? Am I just being curious? Am I being nibby? Do I want to prove something? Do I have a suspicion that something isn't right and just feel like I'm going to get a better way to help the patient or family if I figure this out? Is my search going to advance or compromise the treatment that I'm engaged in? Should I go about informed consent and telling the patient prior to searching? So in the case of the blog, do you say, hey, this is great. I'm glad to hear that you're doing better. I would like to, is it okay with you if I read the blog and just kind of keep tabs on it? Should I share the results of whatever I find in the search with the patient? Should I, or more so, how should I document the findings of the search in medical record, the electronic record of some sort? And how do I monitor my motivations and the ongoing risk-benefit profile? So that's really that constant self-reflection of, why am I doing this? Am I doing this for the right reasons? And am I engaging my patient appropriately? And the bottom line from the American Psychiatric Association to the question of, is it ethical to Google your patients? It's not inherently unethical, so long as it's done with the interest of promoting patient care and well-being at the heart of it. So whatever your choice is, to Google, to not Google, you really have to consider how the information might influence your treatment and your relationship with the patient. And patients should be informed, giving them the opportunity to refute any information that you find, because it might not be accurate or provide full context. So some references, and I will stop my share